Hello everyone, welcome to this panel session at the ICPH 2021. It's wonderful to see you all here and attending from countries all over the world, and I hope you have an interesting and useful conference. It's been a year like no other, and I'd like to thank all of you involved in health and social care for everything you've done during this past year. So welcome to our delegates and welcome to you all for attending. Today's plenary, COVID Perspectives and Learning, will consider the impact of COVID-19 pandemic on doctors' health and well-being, as well as on physician health services, and will aim to build a consensus around what needs to be done to rebuild the structures and support that doctors need. I'm delighted to bring together an international panel of experts who are really passionate about physician well-being to share learnings in this field. And we'll be hearing from Dr. Karen Rowe. She's a senior researcher at the Institute of Medical Studies and Medical Profession in Norway. Professor Colin West, who is a professor of medicine, medical education and biostatistics at the Mayo Clinic in the USA. And also from Professor Subodh Dave, who is Dean-elect at the Royal College of Psychiatrists in the UK. Now, can I remind you all that the panelists' biographies are included on the conference platform, and you can also look at the participants on the screens. The session will include a panel discussion with questions and answers, followed by an optional breakout session at the end, and I'll let you know more about that nearer the end of the session. Please direct your questions to the speakers in the question panel on the left side of your screen, and we can also have technical issues mentioned there as well. We've really got to acknowledge the importance of the discussion today. This is such an important opportunity to bring together individuals and organisations that support the well-being of doctors and medical students and aiming to learn from each other. Please do tweet as well. On Twitter, our hashtag is ICPH2021, hashtag ICPH2021. We've had some really great tweets this week, so please do let us know your thoughts. So without further ado, we're going to have short presentations now from each panelist. And I'm going to start with that now, starting with Karen, then Colin, and then Subodh. I'll invite each of them to share their perspectives for around 5 minutes on this question that I'm going to read out now. What have you learned from the pandemic that you will take forward in your work on physician health? What have you learned from the pandemic that you'll take forward in your work on physician health? So Karen, I'll hand over to you. It's 5 minutes and I'll give you a 1 minute reminder. Thank you.
Hello, everybody. Good to be here together, although we are physically sitting around the world, and to have this opportunity to discuss and think about some perspectives and learning that the COVID-19 pandemic has highlighted. I come from Norway, and since the 1990s, we've had a well-established peer counseling service that's accessible to all doctors who work in Norway. When I talk to doctors who seek help, we often talk about how we have to think about several perspectives at the same time. One perspective is that when we explore the doctor's work situation, we often identify needs for organizational changes at their workplace. But at the same time, the doctor is often exhausted and needs to consider ways of handling the individual situation here and now. Both perspectives are equally important. Organizational changes need to be addressed and worked with, but when the doctor is exhausted, there are often no resources to initiate or contribute to that work. First, the doctor needs to address current exhaustion and find new energy. Yesterday afternoon in the plenary session, overarching perspectives of what possibilities the pandemic could give of changing the course of healthcare and of society were discussed. Those are important perspectives. Let's keep them in mind and come back to some of them in the discussion. At the same time, we need to consider the perspective on another level. And in this short introduction, I have taken the perspective of the doctors, often exhausted doctors, that I've met and talked to during the last year. As we know, the pandemic has put an enormous strain on society, on healthcare, and on all professions, including physicians. Studies of health personnel during this last year confirm that depressive symptoms and anxiety have increased. And in the counseling services, we have seen that the demand for help has increased dramatically during the late autumn of 2020, and especially during the first months of this year. And we've had to engage more counselors to meet this need for help. Most of the doctors haven't sought help primarily because of the pandemic, but the pandemic has been an important additional strain in an everyday life that was already on the margin. It's possible to manage such additional strain during an intense and extraordinary period of time, but now a year has passed and we still don't really know when we have a normalized situation. So can there be any silver lining in this? Can the pandemic in any way have a positive impact in relation to physician health? And the doctors I've met point to 3 areas. The first is self-care. Several doctors experience that the pandemic has provided an important experience related to self-care. The obligation to stay at home when experiencing respiratory symptoms in order to take care of them and protect themselves, their colleagues and their patient has sparked a reflection about the need for increased self-care. And it's become a more visible necessity, both for the individual doctors, but also for their colleagues and by leaders of healthcare. So going to work also when ill is often understood as a professional expectation. The doctors I meet are now talking about a possible shift in this understanding. In the research community and in fora where we often discuss physician health, the concept of care of the patient requires care of the provider is well known and accepted. But for the practicing physician, this has still very often not been a reality. Self-care has also become more accessible during the pandemic, as peer counseling in Norway is now also possible via electronic platforms. And some doctors say that this has lowered the threshold for contact and that it's important to be able to have multiple choices.
1 minute, Karen.
Yes. Work-home balance. The distribution and use of electronic platforms also for patient consultations, meetings, and continuing medical education programs for doctors has become more common. Some doctors have found that this is a relief in order to be able to handle work-home balance more adequately. And these platforms can give a greater flexibility to us in the future. The last point is meaning in work. In spite of high workload, the focus on actual medicine has contributed to make work meaningful and united doctors in a quest for what can help patients in the best way, finding treatment strategies to a new and unknown disease. Many case descriptions and research papers have been written, engaging the medical community and giving meaning. So this is the one perspective on what can be one perspective of what we have learned from this pandemic related to physician health. More accept for self-care, possibilities for a better work-home balance, and the importance of experiencing meaning. Thank you, Sophie.
Thank you, Karen. That was really interesting. As a GP and family physician myself, I know that self-care, both for patients and for health professionals, is so important. So thank you for that contribution. I'd now like to move on to Colin, who's going to give us his thoughts on that question. What have you learned from the pandemic that you will take forward in your work on physician health? And just on the left side as well, for those watching, there's a question mark. Please do put down thoughts and questions there for the panel. Over to you, Colin.
Great. Thank you so much. It's an honor to be with all of you, and thank you to all the attendees from all around the world. My thoughts are going to align very well with Dr. Rose, and I'll just add a bit of my own perspective on top of that. In terms of what we've learned, I actually think much of what we've learned is more of a highlight and reinforcement of things that we already knew about physician well-being. We know that physician well-being was strained prior to the pandemic. And yet, in the midst of the pandemic, even beyond our capacity, we've risen to meet the need. We run toward a crisis that we tell everyone else to run away from. And we have to recognize that there is a cost to this. And unfortunately, around the world, we haven't seen the end of this cost. That highlights that attention to well-being has never been more important. And rather than focusing on the negative aspects of the pandemic, which of course are there, it also presents an opportunity. And as I was thinking about this recently, this conference, even though we're all virtual, I'm considering it based in London. So we need a Churchill quote. Never let a good crisis go to waste. And that in no way is intended to diminish the impact of the pandemic. But we really let the pandemic roll over us if we don't respond in a way that allows us to improve the situation post-pandemic. So there's an opportunity. That's my first perspective. The second is, I think it's worth taking a moment to think about how the pandemic has reinforced how incredibly adaptive, resilient, and humanistic we are as a group. Dr. Rowe mentioned this, the meaning that we've experienced in this work that we bring to our patients and our populations has been felt in a way that many of us in our careers had not felt before. It had not been compressed in such a way. I like to talk about the MVPs of well-being, meaning, values, and purpose. And I think that the pandemic has emphasized those. But again, we need to think about this in a balanced way. All of us are familiar with the Nietzsche quote, "He who has a why to live can bear almost any how." Well, we certainly have our why during the pandemic, but we need to be mindful of the word almost in that quote, because we have stretched our healthcare professionals to their very limits. Again, that means we need to redouble our efforts for support as the pandemic wears on. And then finally, I think we have been reminded, and the public in many ways has been reminded, that physicians are human. We have unique needs as the members of a profession with a deeper calling, but we also have basic human needs. And those have often been put into the background. But during the pandemic, self-care, being well ourselves, making sure our families are protected and safe, the need for community and connectedness, these are not physician-specific needs. These are part of being human. And the pandemic, I think, has emphasized that physicians need those basic elements to be supported. We'll go to the ends of the earth for our patients. So we need systems that are structured to keep us safe and allow us to recharge and thrive over the long term. Many of us around the world have felt like we're trying to sustain a marathon at a sprinting pace. And we know that that's simply not possible. So we have an opportunity, again, closing with a positive, to be able to leverage the pandemic in a way to highlight all of these positive approaches that we can take to promote physician well-being, not just for ourselves, but for our patients, their communities, and really all of society.
Thank you, Colin. That was really insightful. And I think you're right. I mean, we're seeing this pandemic tragedy play out across the world, and the pictures we're seeing now from India and Brazil and elsewhere are just shocking. And despite all the tragedies, we have to learn from this past year and help our colleagues who are suffering, doctors, nurses, others who are suffering so much. And we have to learn from that and help them with that and improve their health and well-being. So thank you, Colin. So I'd like to move now to Subodh, who's going to give us his thoughts on the question, what have you learned from the pandemic that you will take forward in your work on physician health? Thank you, Subodh.
Thanks, David. And again, welcome to everyone. I think I can see that there are people from around the world, so a warm welcome to all of you. I think my thoughts follow on neatly from Karen's and Colin's, really. I think COVID has really shone a spotlight on a problem that has existed for some time. I've been a psychiatrist for nearly 3 decades, and I worked both in India and in the UK. And what I realized was that the jokes about psychiatry were the same in India as they were in the UK. And I think for a long time, I feel the whole idea of health, physician well-being, and mental health has been kind of swept under the carpet. And certainly, I think that is reflected in our training. I think we all live in societies where we wouldn't send anyone on a building site without a hard hat. And yet, I think it has been routine for medical training for us to go into medical training and think that somehow we'll work our way through issues around our well-being. We all are exposed to, significant mortality, morbidity routinely. And the expectation is that we'll somehow work our way through it. And this year, when so many of us have suffered grief personally, both perhaps in our family as well as in our colleagues, it's really driven the point home. And I think for me, I think it was a turning point this year when many of my acute care colleagues contacted me saying, well, what can we do about our own mental health? So I think for the first time, I think I felt that there was a real acknowledgement of mental health issues from a range of people, not just the usual suspects, as I would call them, because as psychiatrists, we've been talking about it for some time. And so I think for me, the big turning point is that having that open conversation around our well-being and our mental health is really important. It needs to be embedded in our curriculum, it needs to be embedded in our training, and needs to happen more routinely in our workplace. And having said that, I know that, and from personal experience, that talking about mental health is awkward. Not everyone finds it very easy. A few months ago, I had a sprained ankle. I was walking around crutches, and over 2 days, I had about 30, 40 people stop me in the corridors asking me what is wrong with me. And, a few weeks later, I sent an email around saying that I have had a bereavement. I'm just feeling a little bit, upset about that. And of a large team of 70, only 2 people kind of sent an email. And I think, not that they were not caring, but I think there's an awkwardness around initiating conversations around our well-being, our mental health. And so I feel that's something that can be learned, and that's something that can be taught. And we've been running a program called Dr. 1 in 4, and we ramped that up in the last year after the pandemic, purely because people found it so helpful. And this is a program where doctors with lived experience of having had mental health difficulties came and spoke about their experience of what did it mean to have this at work, and what did it mean to kind of negotiate that while maintaining a working life. And it's programs like these, and I think we ran a unique experiment actually, because we did it jointly as an enterprise between our acute care trust and a mental health trust, and I think it really worked very well. And I think there's a real appetite, I think, as Colin said, to build on this crisis and learn from it, and to institutionalize some of the reforms that we've brought in specifically during the pandemic. And I think as people struggled through the initial PPE shortage crisis, and then kind of working with grief, and now kind of in the post-vaccine stage, thinking about how do we run services with a huge backlog, which I think is a story worldwide. I feel that it's important that we don't lose the central concept of self-care and well-being. And we have programs such as Dr. 1 in 4, which are institutionalized in our training and practice. So that's my learning from this.
Brilliant. Thanks, Subodh. That was a really, really good, insightful thoughts from you. And I think you're right about medical training. I mean, I was at medical school many years ago, and there was no mention at all about the mental health and well-being of doctors and students. And it's so good that we have so many people attending today who can make a difference, and we're going to come up with some solutions as well. It's never too late to address this problem. And those of us here today do play a big role in this. So thank you again, Subodh. So next time, I want to take you on to our interactive polling session. This is where we invite yourselves to give us your thoughts on a few questions, and we'll also have some input from our panel as well around a few more questions and interactions. So we're going to put the first polling question up on the screen now, and it should be fairly straightforward. You can click on the answers. You can click more than one answer. Click on the ones you feel you agree with. And the question is, during the pandemic, doctors with respiratory symptoms needed to stay away from work to protect themselves, their own family, their colleagues, and their patients' health, of course. Is this an experience that can influence doctors' thoughts about future self-care? So is this going to change behaviour patterns as we go forward? So click more than one of the answers below. When you have done that, please click submit, which may be just off the bottom of your screen. It depends on your resolution. And then we can look at the answers as they're coming through live. So this is really important. I mean, doctors are, most healthcare workers are not very good patients. We don't tend to look after ourselves very well. We battle on, we go to work when we're unwell. And the idea with this question is to think, has what's happened in the past year changed our behaviour? Do we think we'll act differently? So we seem to be getting some good answers here. So the most popular at the moment is this can promote discussions about how to the care of patients requires the care of the provider. So it's raising the awareness about healthcare workers and doctors, mental health and well-being. And we've also got a high number of you saying that it does remind doctors about their own vulnerability, which is really true, isn't it? We often think we're invincible and we can just continue and battle on. And we've also got a very high number saying that this can lower the threshold for doctors to stay at home when ill in the future, which is a good thing. Okay, I'm going to ask, please do keep answering. Yeah. I'm going to ask an open question now to the panel. And that is, what are the positives that we can take from the pandemic in terms of physician well-being? So what are the positives? So we're looking at answers and solutions here. What are the positives we can take from this pandemic around physician well-being? Colin, do you want to give us your thoughts on that?
Yeah, I'll start with a couple of brief thoughts and then open it up to Karen and Subodh. I think, and some of this I think is informed by a couple of the questions that are coming in on the left as well, that some of these positives do have to still be managed as potentially double-edged swords. But I think there has been a heightened awareness of the physician experience and the stress that is associated with being a physician, particularly in the midst of the pandemic. Everyone has seen the pictures from the wards and the physicians who were living separated from their families to keep their families safe and not able to connect with their families. And of course, other professions dealt with this to varying degrees as well. But back to my comment in the beginning about physicians, as with other emergency professionals, running toward problems that we tell everyone else to get the heck away from. And I think there was more of an awareness and opening up to the public and really to ourselves that is part of what we do. Now, the risk there is it becomes a bit of a hero complex, and appreciation becomes sort of separateness of, oh, these are superheroes who are not human in some way. And I think we have to be careful that the humanistic elements of this shine through. The second positive is that I do think across the profession, there is a nudge, at least, toward a different conversation around normalizing help seeking and recognizing that we need to take advantage of support structures when they're there, and we need to build support structures when they're not. This is something that has been taboo and stigma in the medical profession forever. And we're starting to see different conversations around the world in recognition that help seeking really is something that is important. And then finally, I think from a more tangible standpoint, we've seen forced innovation and experimentation in how we visit with our patients. And the plus side of that, when we think about video visits and things like that, is that can optimize flexibility. We don't feel so non-autonomous in our work days. We can meet patients in settings that fit both their and our needs. But one of the commenters also noted, unfortunately, that could, if misused, convert us to being available 24/7, sort of like the pager phenomenon of your or email, where you're never off of the grid. But I think if that flexibility can be harnessed in a way for positive use, that flexibility gives people a sense of control in their lives that I think can be a huge positive. I'll turn it over to Karen and Subodh for other comments that they may have.
Thank you. So Karen, Subodh, what positives can we take from the pandemic in terms of physician well-being?
Kevin, you want to go next or? Okay, well, I'll go next. Okay, thanks. Following on from what Colin has said, I think I want to make 2 points. One a narrow one, and the second a broader one. So I think the narrow one, I think, relates to shift from the whole idea of focus. I think we've been seeing conversations around physician well-being for some time. I think the conference has been running for some time. I think, as we all know, and I think there are many people who probably pull their hair out each time the word mindfulness is mentioned, or a class on resilience is mentioned. And I think many organizations kind of sought refuge in dealing with well-being by saying that, okay, well, we'll have some resilience training. I think we've seen a shift, I hope, in kind of conversations around the wider system and how that impacts on well-being. And I think the point that Collins and Kat both have made earlier about meaning and value and empowering clinicians. And again, discussions around clinician engagement and empowerment have been going on for some time. But the reality is that health systems are complex, and how do we actually make it happen has not something that has been thought of sort of an immediate importance. And I hope that I think that that COVID has shifted the dial on that this is not something that can be kicked off in the long grass. I think empowering clinicians, getting them engaged, getting them involved, making sure that their work is actually personally meaningful has immediate import. So I think that is something that is really, really critical, I think. The second wider thing, I think COVID and the sad, the event around Black Lives Matter and George Floyd's death, I think has really shone a spotlight on inequalities. And that's part of the work we've been doing here in the UK, and I've been involved in some of that, looking at the disproportionate impact on Black and other ethnic minorities of COVID, and on international migrants, and indeed on and as a psychiatrist for people with mental illness. I think, and I feel that we've seen that people with these protected characteristics are often forgotten. And I also feel that our training, our practice has not always taken into account those social disparities and inequalities that exist. So I feel that it's going to be a broader spotlight in our training on these health inequalities. And I think a better understanding of how we as clinicians are responsible for addressing these health inequalities. And part of that is then addressing the health inequality that we ourselves subject ourselves to. And I think that's the story that's come across today quite loud and clear, that we don't seek help when we need it. We are more likely to suffer mental illness and other health problems. And yet, we kind of muddle along with it. So I hope that the broader spotlight on inequalities will also mean that the self-care then becomes a more acceptable alternative for us.
Thank you, Subha. Karen.
Yeah, very many important things have been said. I think the pandemic has in a way put a magnifying glass on healthcare, highlighting these needs, and that maybe we could have a momentum to act on different needs that have become visible both for the public and for doctors and health personnel. I think it's a very important point that you were making at the end, so both with this interdependence that has been very clearly demonstrated. So I think we have seen very clearly that there is an interdependence between different institutions in society. So in order to enable healthcare to cope, governments have even had to effectuate complete lockdowns of society at large. And we also see clearly the international interdependence that we have and the need to find worldwide solutions. So isolation of a country can only be a very temporary measure, really. So we need to think globally when we seek solutions. Also we see the interdependence, as you said, about different groups that minority groups that maybe in different settings that have bigger needs and that we need to address in order to think about the whole. So I think this interdependence has become very clear, the need to address that.
Yeah, thanks, Karen. And I think this past year has highlighted the fact that we do need to look after our doctors and healthcare workers. And someone in the sidebar I noticed did mention the BMA's strapline, which is we look after doctors so they can look after you. It's important. We need to have a healthy workforce so they can look after their patients. So we're going to move on to the second poll now. So we're going to seek your input again. We'll put this on the screen. And the question is, which of the following has been cited as an aid to physician well-being during the COVID-19 pandemic? Again, you can answer more than one answer, and when you complete it, please press the submit button below the fourth option, which may be off the bottom of your screen. So just scroll down if it is. So please do give us your thoughts on that and around what has been cited as an aid to physician well-being during the pandemic. And we're getting some good answers in again. It's quite even this time. The one out in lead is adequate access to PPE testing and treatment. Certainly that's been a huge issue in the UK. The BMA was lobbying very hard for PPE. Often colleagues had desperate shortages of PPE in the height of the pandemic, and we lobbied very hard on that. And also you can see access to debriefing sessions and mental health support is very popular. Again, it's something that just doesn't happen in many places, and it's so important to have debriefing sessions. So that is something that is really important to focus on. So that's some really good answers there. Thank you. I'm going to now put another open question to the panel. And this question is, what can we do to build the structures and support that doctors need to keep well? So what can we do to build the structures and support that doctors need to keep well? What would we need to do in the future? Subodh, did you want to start on this one?
So I think, in terms of rebuilding the structures, I feel that there are three things I think we need to look at. One, I think, is weaving it in our training, and I keep saying this, but I feel that we need to start from medical students, and I think making conversations around our health an integral part of our curriculum. I think, like you said, the strapline needs to be woven into our psyche from very early on. I think that's quite important, firstly. But secondly, I think in our workplace, and I think I can see in the comment section that many people have commented about health systems being imperfect. Yes, obviously they are. There's no perfect health system, inevitably so. But the reality is that more often than not, I think you find that our clinical world, our educational world, and the kind of managerial and the organizational world work in parallel rather than woven together. And I think we kind of pay lip service to the idea of human factors that affect patient outcomes, and then you'll be asked to go on a seminar to attend that. But I think the whole idea that actually does influence, and that our human resource is the most important asset and the most valuable asset that we have in health systems, is not always internalized. And I feel that internalizing that is quite critical. And that sounds like an abstract thing to say, but I think there are ways of concretizing that. And I feel that there are many good examples of board to ward programs where the board to ward, there are examples of internalizing that we have to acknowledge that our human resource is the most vital element of our organization. And in my own experience, I found that in many places that thinking is missing. I think it might exist in the value statement or the mission statement of the organization, but if you look at the board minutes, or if you look at the minutes of the quality governance committee or similar structures, or the educational program, you find that that's missing. So I think how do we concretely start embedding that is quite important. I think there are programs that will kind of embed the training from board to ward. And the third final point I feel relates to kind of broader funding issues. And I feel that is always critical. I think when we think of funding health services, and if there's a decision around building a new hospital or buying a new mannequin or buying a new ventilator, etc., as opposed to running a service for the well-being of doctors or nurses, you find that that the well-being of staff often goes down the priority list. And I feel that's something we need to look at again, because unless we fund it properly, unless there's adequate resource to support this, it's not going to happen. Just words alone will not work. We need words, action, and the adequate resource to make this happen.
Thanks, Subodh. Colin, Karen, did you want to add anything about what can we do to build the structures and support that doctors need?
I think that as a researcher, I want to bring research into the discussion. I think it's important that we use the research now to look at the issues that we have been talking about today and during the conference. And much of what we have talked about as a possible positive outcomes need to be pursued and examined in different kinds of studies. And I think this is work that has already started and is well underway in several settings that we need to continue. And I think we need, in addition to that, we need to create spaces for reflection on what lessons we have learned and what possible routes to pursue. And this needs time and engagement from us in healthcare, but together with also others in society, to be able to think about routes to pursue. And to add another point to that, during the pandemic, doctors have report in Norway that they have engaged and cooperated in new ways to find good organizational solutions to some of the pandemic challenges. And I think to engage health personnel, and maybe especially physicians who haven't participated a lot in organizational reorganization, is extremely important, and to further the cooperation between health personnel and leaders, doctors and leaders, so that the knowledge and experience of those who actually work with these issues and see the needs are involved in such organizational changes. So to create groups and settings where such knowledge can be used constructively, try out changes and evaluate them, maybe together with research in order to evaluate these changes.
Thank you, Karen. Colin, did you want to add anything?
Yeah, a couple quick comments, and I think I'd also like to note there are just some absolutely brilliant comments and questions in the chat and in the Q&A, and I encourage everyone, if you're not scrolling through those, please do, because the insights are remarkable. And I'm going to build off a couple of those. I think, you know, we generally recognize in an abstract sense that our single greatest resource, as Subodh said, in healthcare is our people. And yet we don't take care of our people. And that disconnect, I think, is something that we really struggle with. We all recognize that we need a commitment to work environments within which physicians don't just survive, they thrive. That's not just for us, that's for our entire healthcare system. But as was pointed out in the comments, we tend to be reactive rather than proactive. And certainly in the United States, when we think about graduate medical education, when we think about legislation that has recently been introduced around practicing physicians and mental health, these are almost always reactive to tragic events, deaths of physicians, trainees. And if we were really committed upstream to core values in medicine, we would be able to make progress towards these changes rather than always trying to put, as someone said, the sticking plaster on to a problem that's much larger than that. And my final point to this, to make this a little bit more tangible, is we recognize as physicians and as people who attend conferences like this on physician health, that there is a moral argument that is unassailable to support and promote physician and other healthcare professional well-being. But there is also a business argument, and it's actually bad business and wasteful to not attend to physician health. We have data from the United States emphasizing that burnout alone for physicians, let alone other aspects of distress and other health professionals, costs our healthcare system billions of dollars a year. No one is accounting for it in any financial statement. So whether, you know, can we afford to implement interventions to promote physician well-being? That's the wrong question. We can't afford not to, because we are throwing resources away at a problem by not addressing it. So when you combine the moral and the financial arguments with all of the other arguments, maybe the pandemic is an inflection point where we can actually make important changes.
Yes, thanks, Colin. Really important thought there. We cannot afford not to deal with this. You're absolutely right. So I just want to go now on to our final polling question, which we'll put on the screen now. This is just a one answer from each of you, please. And the question is, I know where to find help for myself or for my colleagues when faced with impaired well-being. Now, for this one, if you want to use the sidebar for any services you have available locally or things that you set up to help colleagues, then please do write them in the sidebar. And again, thank you so much for all your comments and questions. They all will be read, they'll be taken away, and we'll be using those in the future. So thank you for all your comments. We're getting a resounding yes here to this one, which is actually really positive, isn't it? So people do know where to find help for themselves. You know, the BMA has been leading this, and we have a big health and wellbeing push, and we have a 24-hour helpline that helps support colleagues with peer support and counselling, and that's open to any doctor, student, or member of their family in the UK. And we've seen huge increases in utilisation of this over the past year. So the need is out there. Colleagues are really needing to use that. So thank you for your answers to that question. That is really helpful to see that. And thanks for your comments on the sidebar. So I'm just going to finish this section now, just by inviting the panelists to just offer us your takeaway message, you know, just in a minute, please. What do you want the audience to remember from this session, from what you said, what you've read in the sidebar? Just a quick takeaway message from each of you, please. So who wants to go first? Karen, would you like to start?
Yes. I think, as I started to say, that it's important to remember that we have to look at different perspectives at the same time. So we have to think globally, maybe very innovatively, and we also have to think locally and individually in order to address these questions. So I think such.
Thank you, Karen. Subodh?
I'll follow on from Karen. I think, I feel that translating these ideas into action means actually reaching out and saying something to people. I think, and that's not always easy to do that. I have seen this in the last couple of weeks. I think with everything going on in India, I think my organization, my trust, sent out a message asking people to, and after that email came from the CEO, I had a few colleagues contact me and reach out to me. And I think, so we need to kind of facilitate those conversations. We all probably have it was good to see the response here that many people knew where and how to seek help, but there's also something that we need to do as individuals, and reaching out to someone else, that a random act of kindness, I think, is quite important. So influence policy and influence the bigger picture, but also influence someone else directly in your life.
Thanks, Subodh. It's fantastic bite-sized messages here. So over to Colin.
Yeah, at risk of sounding flip, the way I think about this is, we've all heard the expression, that which does not kill you makes you stronger. I think we have a choice to make, because another expression on that same lead-in is, that which does not kill you just hurts a lot. And I think we have an opportunity to experience post-traumatic growth as a profession, but we have to take advantage of that opportunity. The pandemic has opened a window in the midst of immense suffering. For us to get to a better place in healthcare professions, we have the attention of much of the world and an opportunity that I think we cannot let slip by. If we do, the pandemic will take even more from us as a society. So we need to focus on that opportunity, on the will to make the necessary changes across all of our stakeholders in medicine, and, as it has been noted in the comments, with the engagement of all of the stakeholders in healthcare.
Thanks, Colin, and thank you. You're all fantastic panelists. You all do as I ask you and do, and keep to time. It's wonderful, and I've not had to say you're on mute as well, but I'll probably fall for that one myself now. So I'm now going to move to the questions and ask the panelists to think about some of the questions we've had submitted. And again, thank you to everyone for sending those through. And I'm going to start with one on moral injury, actually. I wondered if any of you might comment on the issue of moral injury or moral harm, and that's around doctors struggling in the workplace around issues that have happened to them. What's the danger and what may be the opportunity of this post-pandemic? Subodh, did you want to start on that?
Yeah, happy to kick off on that. I think we were, soon after the pandemic began, we actually did a small qualitative study, which we are writing up now. which did indicate that this was something that people were actually experiencing. I think, again, in the last couple of weeks, I've been in touch with many of my colleagues in India, and I think when you're faced with a situation where you know you're going to run out of oxygen in 2 hours, then you have to start prioritizing it. And I think that to be placed in that situation is an extremely difficult situation for us as doctors. When you're asked to play God, and I think BBC has been running a whole day of events today, and I think nurses and doctors and all of them were reporting the harrowing effect it's already having on them when they are placed in that situation, when they're having to choose, make decisions instantly. And I feel that the impact of that should not be underestimated at all. I think for all of us, I think we had to go through last year making those kind of decisions at some point or another, not necessarily, maybe choosing whom to put on a ventilator, but at a much, smaller level, thinking about even whether going to work and possibly acquiring the infection, coming back home and exposing your own family to that infection. So there have been, for all of us, there have been decisions at that level. Nothing. I would say that recognizing it is quite important. I think as a psychiatrist, I always tell people, and I think that we are quite bad, I feel, as physicians generally at explicitly labeling our emotions, and we all are used to kind of engaging in cognitive dialogues rather than actually, I think there's almost sometimes a feeling that engaging in emotional conversations is not doctorly like or physicianly like. And I think we need to probably learn how to be more aware of our emotions, and if we are able to do that, I think if we explicitly label our emotions, then there are tools around. I think people again have been posting tools in the chat that help us process them, and I certainly feel that for a lot of us, and I think this is, and I've already dealt with colleagues who had already feeling the impact of moral injury, that this will be a big task for us in the years to come, really. And I think we need to be prepared for that.
Yeah, thanks, Suvan. And some of the comments on the sidebar are really helpful, actually. And we've heard a colleague here who worked in ITU with the media asking difficult questions of them. They're just trying to do their job and feeling really under pressure, and it's very difficult for them. Colin, Karen, any thoughts on moral injury and what the dangers may be and what opportunities it may present?
Very briefly, I don't consider myself an expert on moral injury and don't want to misstate the issues. I agree this is potentially a massive issue that healthcare professionals around the world have dealt with. One of the comments or questions was, what do we know about interventions? I'm not sure we know very much specific about interventions around moral injury. I would hearken back to some previous questions. I think the best intervention would actually be prevention in the first place, when systems are adequately resourced and we are adequately prepared to deal with a crisis. But unfortunately, once you're in the middle of it and you are dealing with the after effects of a lack of preparedness as a system, you have to have systems for some kind of support. And in the United States, many organizations have implemented debriefing sessions after shifts, ways to decompress, ways to recognize this is a shared experience. And so even if it's miserable and negative and emotionally demanding, knowing that you're not alone in that, so that people don't have to feel isolated, even if they're suffering, can at least be a bit of a bridge to, hopefully in the future, getting back to more stability.
Yes,
Thank you, Colin.
I also want to agree with the notion of having fora to talk about this, to share these experiences. And I think it's important when we think about moral injury during pandemic that there are very many different kinds of moral injuries. One is not being able to attend to the COVID patients who have needs, but many doctors have felt that the patients that they are responsible for have been prioritized out of treatment completely, because in order to prioritize COVID patients, and they feel responsible for not being able to give help to them either. So I think we need to think that the spectrum is very broad on this issue, and that we need to find fora both in, I think, at the workplaces, but also in these counseling services to be able to talk about this and discuss it, and make it a natural thing that it's possible to feel like that. Yeah.
Thanks, Karen. Yeah, so we've got time for one more. Another question that's come in. Understandably, the focus has been on the tragic death toll in the past year from COVID. What more can we do to raise awareness of the impact of COVID on survivors and their families, families of healthcare workers? There seems to be a perception that doctors are resilient and just need to get on with it. So what can we do to raise awareness of the impact of COVID on survivors and their families? Does anyone like to chip in there?
I'll maybe make just a quick initial comment, because we've done a bit of research nationally in the United States on resilience among physicians. To the surprise of exactly 0 physicians, even with the increased burnout experiences of physicians have higher resilience levels than the general population. So even with the potential suppressing effects of dealing with increased stress and burnout and so on, physicians remain more resilient. So, although maintaining and sustaining resilience is important, and I don't want to minimize that, we're barking up the wrong tree if the idea is, oh, if you were only a little bit tougher, a little bit more adaptive, you'd be able to get through this just fine. So I think that highlights the need for the support structures. And the question here, I think, is a really important one, because this isn't going to be just a within pandemic problem. We are going to be dealing with after effects, aftershocks for years to come. And when we talk about prevention being so important in dealing with these mental health and stress issues, we should be planning now to prevent and mitigate those problems that we know that we need to be anticipating moving forward.
Thanks, Colin. And you're right, actually, we've been running monthly surveys of our members of the BMA in the UK, and we've had sometimes up to 15,000 responses, and 1/3 of them in the past year have said they've seen increasing depression, anxiety, even PTSD. This is how serious it is, and this will be with us for years to come, and we have to deal with this. Did anyone else want to come in on that aspect around raising awareness of the impact of COVID on survivors and families?
I'll just come in very briefly again. I know we're running out of time, but I think through Doctors in Distress, which some people may recognize, operates in the UK, I think we've been running groups, and from the Royal College of Psychiatrists as well, like the BMA, we had surveys of our members, and the data is very, very clear, I think, linked to the questioner's point. So I think awareness is important, but I think a lot of people are asking, and I think that that we need to move away from awareness to action now, and what kind of help and support is available. And I think this is a dialogue for all health systems to have. And I think whether we need a service specifically for physicians, or we ask them to join the general service, and that is that service adequate or not. And I think these are questions that each service will need to evaluate. And I think certainly I feel that that's the dialogue that we need to have in the UK for the National Health Service. And I'm sure that other systems will do too, because there are pros and cons of each approach. But I think, as Colin has pointed out, that looking after your staff has an outcome also on your patients. And I think that's something that we need to be very aware of.
Karen, did you want to come in?
I can just briefly add that we need, it becomes so clear that we need to look after doctors in this aspect also, because the doctors are going to deal with their patients who are in the aftermath of COVID stress and death and loss. So having support in place for doctors is an example that they can use for their patients, I think.
Thank you, Karen. And once again, can I just thank all three of you? You've been fantastic, and I've learned so much from you, and I hope everyone listening and watching in have learned from our colleagues here, and also from the sidebar as well. For those of you who may have been affected by this in the UK, or you know someone who may, then please do know that the BMA does offer wellbeing support to any doctor, student or member of their family. Just type BMA wellbeing into your favourite search engine and the information is there, and that service is available 24/7. And we're just extending it actually. We're proud to announce that we're providing face-to-face counselling, clearly in COVID-safe environments going forward. So that will be really valuable for colleagues. So I'd just like to draw this to a close now. It's been a wonderful hour. It's gone so quickly. I'd like to thank, of course, our panelists from around the world and those watching in from around the world as well. But this wouldn't have happened at all without the superb help and support. And the four of us on this call here know that we've had fantastic support from staff and others. And I'd like to just particularly mention the BMA conference unit, the BMA's wellbeing team, the ICPH planning committee, who have put together a fantastic week this week, our audiovisual team who've made this happen. It's just worked so well. The field events team and all the staff who've kindly acted as moderators, as well as all our supporters and contributors. It's been a fantastic experience. So for the remainder of this session, actually, we're going to set up some breakout groups. So this is your time to have virtual coffee and chat to other people. So this will be an open, reflective space for attendees to share reflections with other delegates. If you'd like to join other small groups just to chat about what you've heard or exchange experiences, then please wait here. Don't need to do anything, and you'll shortly be invited to turn on your camera and microphone and move to a group. If you don't wish to join, then please press the leave button in the top right of your screen. And it just leaves me, David Wrigley, to say thank you ever so much for all our attendees and to our panelists, and I wish you all very well for the future. Thank you.
Thank you very much.